Welcome. Congratulations on taking the first step. You are making a life-changing decision about your health, and we're so glad you've chosen to partner with Norman Regional's Journey Clinic. Here at the Journey Clinic, we want to make sure you have all the tools you need to improve your life. In the next 20 minutes, we'll talk about the impact obesity has on your health. We'll learn more about the variety of weight loss procedures available through the Journey Clinic. We'll hear about the risks and the benefits of each bariatric surgery, plus what to expect on the day of your procedure and the days following it. Finally, our team of experts will share with you how to best maximize your outcome, lose weight, and become a better you.
Your body mass index, or BMI, is the most accurate indicator of obesity. Obese patients have a body mass index of 30 or higher. Beyond that, patients fall into a number of obesity categories, including severely obese, morbidly obese, super obese, and super obese, those with a BMI of 60 or higher. Obesity is at epidemic levels. In fact, 1 in 3 Americans is obese. And the effects of that excess weight on an individual are staggering, from high blood pressure and osteoarthritis to asthma, infertility, and an increased risk of several types of cancer. Obesity-related conditions can put your health in danger.
The good news is, you can change the course of your life with the help of bariatric surgery at Journey Clinic. We offer a comprehensive program dedicated to your health, your weight loss success, and your well-being.
Our theme at Journey Clinic is that wellness is a journey, not a destination. And I think that that is so key and so important when it comes to considering weight loss surgery, because even when you've met your weight loss goals, it doesn't mean that you have arrived. I think it's important to emphasize that you have to make lifelong changes in order to have lifelong success.
Dr. Lana Nelson is the co-founder of Journey Clinic. Nelson is a published board-certified surgeon. She is fellowship-trained in weight loss surgery and has dedicated her career to helping patients win the battle against obesity.
I think there are many things that are rewarding about bariatric surgery, and that is, as far as the patients go, each patient has their own struggle and their own, unique problems and their unique journey that they go through in trying to achieve weight loss. I think that Journey Clinic is special because we really focus on the individual patients and their needs. Although there are some programmatic requirements that we ask all of our patients to go through, we always take into account that the patients are individuals and they are unique and their needs are unique. And it's also not just about the preparation for surgery, but support after surgery.
From your very first visit to Journey Clinic, we'll prepare you for the road ahead, arming you with the information you need to ensure you're ready, physically and mentally, for a life-changing bariatric procedure.
We know you have specific questions about your weight loss surgery. Our medical team is ready and waiting to talk with you about every one of your concerns.
The comprehensive care at Journey Clinic includes regular visits for the first year, then annual visits thereafter, weight monitoring and nutrition counseling, psychology assessment, and physical therapy. You'll start your journey with a bariatric navigator, a patient advocate who walks with you from start to finish. Your bariatric navigator will help you with the insurance process to make sure you meet all the requirements of your insurance provider before surgery. It can be an overwhelming time leading up to surgery. Our team is here to help.
We've got physical therapists that we work with, and within our system at Norman Regional Health System, we have access to a wide variety of medical specialists who assist us in the instances in which patients may have additional needs that can't be met right here at Journey Clinic.
At Journey Clinic, our registered dietitians know the obstacles you face in daily life.
It's hard. Making changes to diet and lifestyle is not easy. And I think being there to encourage and to kind of be their cheerleader and their support is helpful, because maybe the people in their home are not on board, or maybe they don't fully understand what that patient is going through.
Dramatic weight loss is an emotional event. Our mental health team is ready to help you navigate the changes ahead.
The Journey Clinic treats the whole patient, the whole body. We address the mental health, the physical health, the adjustment after surgery. We talk about what it's going to be like before surgery, and I really think that the Journey Clinic really is set apart in that aspect from other clinics or other programs because they really take everything into consideration and want to make sure that the patient is healthy from top to bottom before moving forward.
The team at Journey Clinic specializes in 3 state-of-the-art bariatric surgeries: gastric sleeve, gastric bypass, and lap band. The skill of our surgeons is just one reason Journey Clinic is recognized as a bariatric center of excellence by the nation's leading accreditation organization.
Choosing which weight loss procedure is right for you is one of the most important decisions you will make. At Journey Clinic, we have several safe and effective options.
Gastric bypass surgery has been successfully performed since the 1960s. The procedure used to be done with a large open incision. Today, at Journey Clinic, our surgeons utilize the latest in bariatric technology. 95% of our gastric bypass surgeries are performed laparoscopically, with small incisions in the abdominal wall.
It's really considered the gold standard procedure when it comes to weight loss surgery. And when we say gold standard, that's the procedure that other procedures are compared to. The first thing that we do with gastric bypass is we create a small stomach pouch. And when we create that stomach pouch, we're leaving about 5% of your stomach that is used. The remainder of your stomach is actually bypassed. And although it's functional and it's still living and it could be used 10 years from now if you needed it again, it is not utilized normally after the initial procedure.
The advantages to gastric bypass include rapid, consistent weight loss, sustained weight loss, and significant improvement in obesity-related health problems, including the remission of diabetes in many cases.
There are some individuals who will not see success that we expect with any procedure, but the success rate is the highest with gastric bypass when it comes to weight loss.
Gastric bypass disadvantages include nutrition deficiencies, ulcers, and restrictions on non-steroidal anti-inflammatory medications.
So most people will consider that gastric bypass is the most invasive of the procedures that we offer. Even though it's done laparoscopically in a minimally invasive manner, the surgery itself is still considered extreme by some and still considered to be invasive. And that's because we are bypassing or rerouting a portion of the stomach and the small intestines. And so some people are not comfortable with the possibility of rerouting their intestines. People may be more prone to developing nutritional deficiencies after gastric bypass. And it's certainly something that has to be monitored.
Studies show 30 to 40% of patients may develop nutritional deficiencies if not taking the appropriate supplements.
Some of the other disadvantages of gastric bypass are the risk for something called a marginal ulcer or ulcer formation in the pouch. And that is more common in individuals who have to take anti-inflammatory medications.
If you take ibuprofen, Mobic, or Aleve, or if you are dependent on medications for joint issues, then gastric bypass may not be the best option for you. Another disadvantage to gastric bypass surgery is called dumping syndrome.
If an individual eats something that's very concentrated in sugars, sometimes it can happen with something that's very concentrated in fats, then those foods will reach the digestive system without being diluted, without being broken down, and that causes a release of digestive juices to help break those things down. Well, the side effect of that is something called dumping syndrome, and it can cause intense abdominal cramping, dry heaves, nausea or vomiting, cold sweats. It's really a miserable experience for someone that experiences dumping syndrome.
Dumping syndrome is avoidable, however, by following the prescribed diet instructions following surgery. Gastric sleeve surgery is a laparoscopic procedure where a portion of the stomach is surgically removed, leaving a small sleeve of a stomach.
When some people hear the word sleeve, it sounds maybe like there's an implant or you're actually kind of wrapping something around the stomach, but the truth is that we place a narrow tube into the stomach. We use that tube as a sizing device, and then we actually remove about 70 to 80% of the stomach. So what you're left with is a narrow stomach tube or a sleeve of a stomach, and so that's where the name gastric sleeve comes from.
The advantages to gastric sleeve surgery include its ability to help curb hunger and results in effective, consistent weight loss with a much lower risk of dumping syndrome, no rerouting of the intestine, and there are fewer restrictions on non-steroidal anti-inflammatory medications.
It is highly effective for weight loss. It is comparable to gastric bypass, maybe not quite as good in terms of the weight loss as we see with gastric bypass, but it does have effective, consistent weight loss, and so that's certainly an advantage of the gastric sleeve. One of the other advantages is that there's no rerouting of the small intestine. So compared to gastric bypass, which involves rerouting, there is no rerouting with the gastric sleeve.
Disadvantages of the gastric sleeve procedure include a potential for acid reflux to worsen after the procedure. Also, gastric sleeve is not reversible, and there is less long-term data available about gastric sleeve because it's a newer bariatric surgery. The third procedure we're going to cover is lap band surgery, another laparoscopic procedure. It is considered the least invasive. Lap band surgery is often an outpatient procedure, only occasionally requiring an overnight stay in the hospital. The lap band is also known as the adjustable gastric band. The procedure involves implanting a device around the upper portion of a patient's stomach. The band constricts that portion of the stomach, forming a pouch, and restricting the amount of food a patient needs to feel full. The band is attached to a port, surgically placed near the muscle in the abdominal wall. After surgery, our staff can adjust your lap band with a special needle inserted into the port to fill a balloon with fluid.
When we fill the balloon, it narrows the opening, which slows the release of food from the little part of the stomach pouch on through the digestive system. So it's what we call a restrictive surgery. That means that it restricts the amount or the volume of food that you need in order to feel full. The lap band is considered the least invasive of all of the surgical procedures that we have to offer, so that's appealing to a lot of individuals.
Here are some advantages to the lap band procedure. It is reversible with a low risk for malabsorption. It is considered the least invasive bariatric procedure, often allowing a patient to return to work quicker than gastric bypass or gastric sleeve. Disadvantages include a possibility the implanted device will require maintenance. The band may slip, erode, or leak, requiring a second surgery.
If the port becomes detached from the muscle, or if the tubing to the band breaks, then those are problems with the device itself. There's also something that can happen called a gastric prolapse, which is basically where the stomach moves or migrates up through the band, and that can lead to things like blockage or severe reflux or severe vomiting, and those are things which require another surgery to be corrected.
Weight loss following lap band surgery is not expected to be as effective or as dramatic as other bariatric procedures. Each of these bariatric surgeries has advantages and disadvantages. It's important you talk with our team of experts about the procedure that's right for you. It's also important for you to keep in mind, no surgery is risk-free.
So you have to take this into consideration for yourself and for your friends or family members. There are some serious risks associated with weight loss surgery. And when it comes to serious complications such as death or blood clots or leakage or severe infection, although these things don't happen frequently, there's still a possibility and you're exposing yourself to that risk. So you really have to understand that there is nothing that we do in surgery or in medicine that is without risk. So you have to be ready to take that step.
Surgery can be an extremely effective tool for losing weight.
General side effects of weight loss surgery include nausea, diarrhea, constipation, lactose intolerance, hair loss, excess skin, depression, and psychological distress.
Although it's a decision that I say you shouldn't make lightly, it's still a decision that can be the right decision for you. I really don't think that the risk would stop you or preclude you from having surgery, because we expect that on the other side you're going to be happier, you're going to be healthier, You're going to have a decrease in your health problems related to your weight. And so that's why we offer this as an option for you. Typically, your first visit to the clinic will be a visit with me, and we get to talk about your health history and about some of the reasons why you're seeking weight loss surgery, maybe some of the considerations that you've made and contemplating your choice and your procedure of choice. And we'll also develop a plan for you, a plan that will help prepare you for surgery. At that point, we'll also order any additional assessments that you need.
Lifestyle changes are essential to ensure long-term success. Patients need to be ready to meet all of the physical, behavioral, and social challenges of weight loss surgery.
Whether you choose gastric bypass, gastric sleeve, or lap band, our team of skilled surgeons will help you lose the weight necessary to live a healthier life.
It's possible for anybody after any surgery to lose weight and to be successful with that. And sometimes it happens even when they're not making the best choices when it comes to dietary and lifestyle choices. But those are the people that we see back 3 or 4 or 5 years later who put their weight back on. And so it's important to emphasize that change. You really have to see weight loss surgery as an opportunity to achieve success that you've not been able to achieve on your own. But you have to make changes in order for that success to be long-standing.
In order to prepare for weight loss surgery, Journey Clinic patients must be up to date on all screening tests, including colonoscopy, mammogram, and pap smear. Bariatric candidates should quit smoking tobacco and stop all alcohol consumption. Regular exercise is encouraged, and so is attendance at a Norman Regional Support Group.
When you arrive at the hospital on the day of your surgery, usually it's pretty early in the morning, and when you check in, you'll be brought to a preoperative area where you'll have an assessment done by the nursing staff. You'll have lab work that's drawn, you'll have an IV that's inserted, and then you'll get to visit with the surgeon and the anesthesiologist and the nurse from the room that you'll be having your procedure in.
For gastric bypass, expect the procedure to last approximately 1 hour. Most patients will spend 2 nights in the hospital and take at least 2 weeks off from work. For gastric sleeve surgery, expect a procedure time of approximately 40 minutes, with a 1 to 2 night stay in the hospital. Expect to take about a week off work if you have a desk job, longer for those with physical labor jobs. Lap band surgery is performed on an outpatient basis with a procedure time of 30 to 40 minutes. No hospital stay is needed following the procedure, but you should expect to take 3 to 4 days off of work, longer for those with physical labor jobs. With all bariatric procedures, you will be restricted to clear liquids while in the hospital and protein shakes upon discharge. After surgery, you'll recover in a specially equipped private room designed to make your experience as comfortable as possible. Your medical team will make sure you have everything you need for recovery.
At Journey Clinic, postoperative care begins here and continues for as long as you need our help. We believe that patients have the best outcome when they are prepared for the trip home and life after weight loss surgery. Our team is excited about helping you reach your goals.
Our expectation is that once you get to the unit, it's usually about an hour or so after your procedure, that you'll be ready to get up and sit in a chair and maybe start walking, because all of those things will help decrease the amount of time that you have to spend in the hospital, decrease your risk of things such as blood clots and lung infection and that sort of thing. So we really expect you to kind of be up and moving even the day of surgery.
Your post-operative care team includes nurses and physical therapists who are specially trained in the field of bariatrics. Their expertise will help maximize your recovery and prepare you for your trip home.
Most people really want to know how long they have to be off work, and it really depends upon what kind of work that you do. If you have a sedentary job or a desk job, most patients will be able to take 2 weeks off of work and be able to go back. If you have a very physically active job where you're on your feet, where you have physical requirements of you that require you to lift, then you're likely going to have to take about 6 weeks off after surgery.
Here at Journey Clinic, We know that the success of every bariatric procedure is determined in those first weeks and months after you leave the hospital. We want to make sure that you are prepared for life after surgery. You're going to eat differently, feel differently, and live differently. And that's not easy. Our team is ready and willing to help you make that important transition. We want your surgery to be a long-term, lifelong success.
Most people think that their care ends with surgery, but from my perspective, your care begins with surgery.
After your surgery, the Journey Clinic team will schedule regular follow-up appointments at 2 weeks, 6 weeks, 3 months, 6 months, and every year following. In addition, lap band patients have monthly visits for the first year. At Journey Clinic, we will monitor your weight, your diet, and your nutrition. We encourage all of our patients to take advantage of our individual psychology, nutrition, and physical therapy programs, and to participate in our support groups. And remember, these post-surgery appointments do not replace the care provided by your primary physician. Each patient meets with a registered dietitian to help navigate the dietary challenges that come with food choices before and especially after bariatric surgery.
After surgery, it becomes a little more challenging just for them to actually eat or to drink, even minimum intakes. And so kind of helping them get through those phases initially and getting to establish healthy eating habits after surgery is probably the biggest struggle for after. And then of course those stumbling blocks that you come upon, holidays, Christmas, tragic events, deaths in the family where you kind of fall off your routine or your plan, and then helping them get back on.
At Journey Clinic, we teach our patients that making healthy food choices is absolutely necessary for long-term success. In the weeks and months after surgery, you and a dietitian will work together on a custom eating plan to keep you on track. Also, our team of behavioral health professionals stands ready to help you adjust to the emotional changes you face after surgery.
It's very important to me to provide education and to really hit the things that they might not think about, such as, if we're an emotional eater, after surgery, that eating is gone, that coping skill is gone, and you still have emotions, but no way to cope with it, and a lot of patients don't think about that. So I think for me to be able to sit down and talk with the patients on an individual level and figure out more what it is about them that led to where they are today, and how we can go about addressing that or give them things to think about that might be affected after surgery. This is a lifestyle change, and that it takes a long time and a lot of adjustment to figure that out and kind of be okay with it. This isn't I'm gonna have surgery just so I can eat the same things but less of it. And as you make a lifestyle change, your thoughts about yourself change too. And I think that's the most important thing for people to keep in mind, that they're changing everything about them, including how they think and feel about themselves.
It is important to remember, bariatric surgery is not a quick fix. Your surgery is not without risk. In fact, surgery isn't the right choice for every patient. Surgery is a tool requiring lifelong change to be successful. Research shows for patients struggling with morbid obesity, bariatric surgery is the most effective treatment. Remember, we strongly recommend you take advantage of our monthly support group and connect with other bariatric patients. It's a way to stay motivated and on track. At Journey Clinic, our goal is your well-being, inside and out.
Thank you for choosing Norman Regional's Journey Clinic. We're excited about helping you make lifelong changes to reach your weight loss goals.